Good afternoon, ladies and gentlemen. We are here for our weekly media briefing, and the Premier and the MECs are here. The Premier will start with the presentation, and then MEC Masuku and MEC Lesufi will also make their presentations, and then we'll take questions. Over to you, Premier.
Thank you very much, Thabo. Good afternoon, ladies and gentlemen from the media. This is our weekly media update on COVID-19 in Gauteng Province. We always start with our strategy guided by 6 pillars, starting with the comprehensive health response, but moving beyond that to deal with issues of food security and social relief. In the process of our work, improving the capacity of the state to respond to the needs of our people, and also the agility of the state, using this period to also sharpen the capacity of our government to deal with any disaster that will arise. That's the 3rd pillar. The 4th pillar, work related to the economy. We will share with you today some of the work we've been doing since the last briefing we did 7 days ago, and the work in the area of social mobilization and human solidarity. MEC Masuku will speak a little bit today about our strategy in communities to do some of the things we have done in the early phases, but upscale, especially in communities where we think the level of observance of the measures such as wearing masks, social distancing, sanitization is low. We always also share with you the work of our law enforcement agencies. Firstly, just to deal with crime, as we have always done through our work on Ukaimolao, but also issues pertaining to the enforcement of the regulations, but also the protocols of the World Health Organization to help us combat and contain this pandemic. So today we structured the briefing this way. I am going to give an overview. Immediately after that, we will get MEC Masuku just to share with you the work and our approach on hotspots. These hotspots, there were hotspots in the early period. Last week we shared with you the first phase of the outbreak of the pandemic. The hotspots were in the suburbs. Now the hotspots are shifting to the CBDs and the townships. MEC Masuku today will say a bit more about what our approach is to dealing with the hotspots. And the 3rd presentation will be by MEC Lesufi. We want to privilege a report on what our plan is for the reopening of schools, just specifically in Gauteng. So MEC Lesufi today will do that based on what the minister has announced, but also specifically giving an indication of Gauteng's readiness. So this is an update. You know, a week ago when we briefed you, this is where the cases are now. The national picture announced by the Minister of health, we have 18,003 confirmed cases, 8,950 recoveries, 339 people have passed on. The test conducted nationally is 506, 861,000 tests. And we often share with you the national picture and say, how does it compare with the province? So these are the figures that were shared last night. The national picture, again, we give the breakdown of the provinces. This is the data that has been well publicized. One of the important information we would continue to track as a province is with regard to the national picture. How have things been shifting? You will see that in terms of confirmed cases as of the 20th, that's the announcement made by the minister last night, Gauteng constitute 13% of the confirmed cases. I always say you've got to compare this with where we were before the national lockdown. More than 50% of the cases were of COVID-19 confirmed in South Africa were in Gauteng. It is also important to also just look at the active cases. There's confirmed cases, but of the active cases, Gauteng has 8% of the national active cases. So you would see that with regard to how many active cases are there, we even have a much fewer percent. This is as of this stage, at this moment in the progression and the trajectory of the pandemic, as of now. Every week we will be giving you an update to see if there are changes and to be able to highlight to you where the changes are. And where there are increases that are undesirable, that pose a risk, we will be openly sharing that information with you. Where there are new trends that are worrying, we will be sharing that information with you to also say, what is it we are doing? Last week, we shared with you a big concern, a trend about growing cases in the townships. That's what we shared with you. We shared with you those maps, the geolocation of the new cases. The recoveries, you would also see in terms of the contribution of each province to the national recoveries. We are at 19% of the national recoveries. We contribute 19% of the national recoveries. You would see that the different provinces are at different levels. The Western Cape contributes 57%. And then the fatalities or mortality, Gauteng contributes 8% to the current numbers of those who have left us, those of our citizens who are no longer with us as a result of succumbing to COVID-19. We also always say to you, last week we were here. So last week, the numbers, when we briefed you last week, we had 2,074 confirmed cases. Last week, we had 1,547 recoveries last week, and we had 503 active cases last week, and 24 deaths in our province. So 7 days later, where are we? 7 days later, our cases, confirmed cases, are 2,400. The number of recoveries are 1,729. The number of active cases are 644. And the deaths are 27. Thinking about those who have left us, we would like to convey our condolences to the families of the deceased and hope that in time they will find comfort in thinking about the legacy of those who are no longer with us. And amongst the eminent public health workers who left us is Professor Anton Stolz, who was a very key player in the fight against COVID in the Steve Biko Hospital cluster. Steve Biko is in Tshwane. And in March, the MEC for Health and I visited that complex. Steve Biko is one of the centers of excellence with tremendous capacity to help us in the fight against COVID-19. So we convey our condolences to Professor Stoll's family, and we know that he's been undergoing chemotherapy for cancer treatment. He was a very key player in the eminent health experts in our province who really helped us to prepare for the fight against this pandemic. We will miss him. In terms of the further breakdown of where we were last week, you would see we had 74% recoveries. We always say that the province recoveries are on average 70%. Sometimes it's more in a week. In a week, on a weekly basis, our recoveries average 70%. So last week we were at 74%. You'd see this week we are at 72% of recoveries. I've already shared with you what the mortality rate is still at 1.1%. The active cases are at 27%. Now you would see the number of active cases are more than what they were last week. Not just in numerical terms, but also in percentage terms. 25% was last week, now is 27%. So we do watch this area very closely. The number of active cases, it means these are the people who require attention of our health interventions. They require attention. We need to know where they are, that they are in quarantine or in self-quarantine. And including those who need medical attention, that our clinicians are they are paying attention to them, so they are essentially under surveillance as well. Who amongst them need hospitalization? Because some of them, and most of them, would always just have mild symptoms, but those who need hospitalization, but also, as you focusing on the active cases, you want to make sure that they are not interacting with the general public or family members, and therefore infecting more people. So it's always important for us to focus on how many active cases and have all kinds of measures around those active cases, that we know on a day-to-day basis our health professionals, the senior management team that's guided by Dr. Masuku pays very close attention to those. We also, week by week, share with you what's happening with the curve. You would see our curve has been inclining. It's not steep, but it is inclining because we are it's not flat in the way we would like it, because we're getting additional cases, new cases every day. But you'd also see that the curve of positive cases, whilst is going up, but also the curve of recoveries is going up. We would like to see a situation where the curve of recoveries actually crosses over the active cases. We would be very happy, and that we actually have been able to reach a point where there are as many recoveries But that is not possible to realize because there is no vaccine. And we are still in the early phases, and many of you would have listened to the discussions amongst the modelers earlier this morning, and they are looking at data and projecting what's going to happen. We always say to you, so far, so good, but the road ahead will be tough. The road ahead will be tough. And we don't want to give the people of our province false hope. We always say we need to do all these things. So far, we have been able to do well under the lockdown conditions, and the lockdown has worked for us in Gauteng. Evidence is there to point out that the lockdown has worked, but the road ahead is something that we must chart together under the guidance of the National Command Council. Flu immunizations, so every week we're giving you data about flu immunizations, and this is the immunization of those who are our frontline staff, but also the various sectors of the population at risk, the elderly, the children, pregnant women, those with chronic diseases, and those with, specifically those with HIV and AIDS. So we will update you every week on how we are doing in this regard. Back to the numbers on screening, we're now at 4.4 million people who we have screened in Gauteng. You would see that it is in Tshwane where the largest number of screening has happened. Tshwane is at 32% with screening. Ekurhuleni and Johannesburg are at 33%. And then you have the other two districts, Sidibeng at 10%, West Rand at 8%. That's with screening. Of course, you can't treat screening in isolation with testing. So if this is how we are doing 4.4 million people with screening, you can't just deal with screening alone. It's not enough just to screen, as we are reminded all the time, because there are people who are asymptomatic. You also have to test. These figures were shared by Minister Mkhize. We always have to trace how many people have been tested in Gauteng relative to the national tests that have been conducted. You saw last week, when we did this briefing last week, Thursday, we had 127,030 people who were screened, and we now have 166,000. Gauteng province contributes 33% to the national total of all the people who were screened. And in fact, there's also an indication from the National Health Laboratory Services that in terms of the number of new tests conducted, we are also doing quite well. We are leading in that regard in the number of new tests conducted in terms of the report that they released yesterday. Of course, we still want to do more, but we can only do so at the pace that the country is moving at, including ensuring that the test results are obtained as swiftly as possible to help us with the interventions. And that's a matter Dr. Masuku and the head of department, Professor Lukele, have been engaging very closely with our National Department of Health to improve in that regard. Again, I was saying to you, when we have active cases, we also are interested in how they are doing. So in those active cases, one of the important areas is to ask the question, what's happening with the hospital admissions? We have 62 people who are admitted in hospital. So the number of people admitted in hospital per week in Gauteng, you'd see it averages between 48 and 72 people admitted in hospital. And amongst those, we also have to ask a critical question: how many are in ICU? And how many are in ventilation? We're sharing with you 4, 2 in the public sector and 2 in the private sector. 4 people are in ventilation. There are others who are in ICU and high care, another 20 who are on oxygen, and others are in general wards. So you'd see that in general wards we would have 38 people who are in general wards, 11 on oxygen in general wards, and 27 on room air in general wards. So if you want to understand what's happening with mortality, this is where to look at. And we always get feedback from our clinicians around this. So we're interested in how many people are on ventilation, who have been intubated, who have recovered. It's a very important indicator of the extent to which the interventions by our clinicians are working. We know there is no vaccine, there is no cure, but we have shared with you from time to time what our clinicians are saying about what they really focus on to try and save life. And so far, those are the things they have done. They have said to us, early interventions are important, to put people on oxygen, fluid supportive treatment, prone position, and blood thinning. They are doing all that as part of the early intervention. So when people have reached the stage where they really have to be admitted in hospital and they require treatment, the clinicians pay attention to all that. We always share with you this. Last week, when I was reading this number, I know there was a mix-up I've never had in my life. Not when I was at school on mathematics, not when I was at university. I've never had that mix-up. I think my tongue was on lockdown. Just to say 8,301. I started with 800 and then had 300 and then went to 8,000. So I'd never had that mix-up in my life. 8,301 are the number of beds that are currently available in both the public and the private sector. But we know these beds are not enough. And it is for that reason that we always report what more beds are we going to need. And from the modeling, these discussions that has been taking place amongst the scientists and the modelers, the data scientists, the epidemiologists who are working, the data scientists, the feedback we are having, Ms. Masuku, is that we may need more ICU beds. So the number of beds that we have been reporting here that we are adding, depending on the latest modeling, may not be enough. So that's what we are looking at. And it is for this reason that yesterday we welcomed the contribution that BMW and Nissan in Roslyn want to make. So BMW and Nissan in Roslyn, this is the automotive sector, would like to set up a field hospital in partnership with government, like the automotive industry has done in the Eastern Cape. And we welcomed that initiative because it will add more ICU beds for us. So we are working with BMW and Nissan on that initiative. And I want to take this opportunity to really thank them. So those sectors of industry that can put more resources to enable. We have up to 10,000 workers working in the automotive sector there in Roslyn. And Roslyn is just adjacent Soshanguve. So that facility, the field hospital that the automotive companies would like to set up with us there, will go a very long way in adding to the number of beds we have including in ICU. So the MEC for Health is finalizing the plan with the automotive industry companies that I've referred to help us increase the number of beds, because we must never be too comfortable. So when our national government, especially the minister, says to us, we can see the number of beds, but you need to do more, we go back and do more, because we must be ready for the worst. We must never underplan. It is better to be over-prepared than to be under-prepared. We also want to share, contact tracing is very, very important, because if you have positive cases that we are watching very closely, and we have traced all the contacts, it's not enough just to know these contacts. We geo-map them. We also map where they are located. But it is also important to find all of them. So contact tracing in Gauteng, this is from the National Department of Health. You'd see that this slide was shared with the citizens of our country by the minister. We are at 98% of contact tracing. We want to get to 100% of contact tracing. Basically account for everybody, every single. So every time there is a report, every day when there is a report, every time there is a report on the number of new cases, the first issue of interest to us is where are they? Who have they interacted with? Under what conditions are they now? Are they in self-isolation or not? Or they need to be put in our facilities, quarantine facilities. But also tracing, once we trace the positive cases, tracing all the contacts, particularly now that the pandemic is going into our townships, we have been putting those contacts that are in the townships where it's difficult to self-isolate and self-quarantine. We are also putting them, they need to spend 14 days in our quarantine facilities. So that's what we are doing. So if you want to know the story of Gauteng is that you can't find that someone is positive and then they get left in a community where they are going to be interacting with people. But also once you have identified the people who are contacts, who need to be isolated until we are sure that they have not been infected, even those people need to be taken out of, especially in the townships, they need to be taken out there and be put in these quarantine facilities that we have been setting up. So contact tracing is very, very important because it is the basis on which we can contain the spread and ensure that we limit the number of people who are infected by knowing and ensuring that those who are infected are in places of isolation, and those who have had contacts with them are also in places where they are not going to, in case you know later after they are tested, and in case you know the results and the results turn positive, you want to be sure that in the 14 days of isolating them, you are taking safety measures there. PPE stock. Last week we had 11 million of the PPE stock. You can see now we are at 11.4 million of PPE stock. We are continuing to order. We had ordered 65 million PPE units. We are increasing the stock because we are anticipating that the road ahead will be tough. We are going to need more staffing, and we have to ensure that all our staff, our frontline workers are on that. So every week we will be updating you on PPE in terms of our stock levels. And wherever there's a protest and a complaint in an area that workers there say we don't have PPE, I turn to the MEC and say, but MEC, how can we not have PPE when we have this in stock? And the MEC is always able to come back and check what is the protest about, what is behind protest in a clinic or in a hospital. This is what we always share with you about the various units of PPE, which I'm not going to take you through. Food security, just an update. We have been able to distribute 136,880 food parcels. This is to households, and therefore impacting or being able to feed 684,400 people. So since the journey of the lockdown, this is the number of people who have been able to help in providing food in Gauteng. You know that amongst those people, the number I'm giving you excludes the homeless people. The number of the homeless people who are being fed 3 meals a day in our 47 shelters, that number you'd see there. It goes up and down every week. 1 week we have people leaving, another week we have more people because the others have arrived. So we have been able to provide shelter and meals to 3,167 people who are homeless. We want to do more, but sometimes some of the people just decide that the restrictive conditions of shelters is not something they would like to put up with. Another important area of work, which is a pillar here, is about enforcing measures related to social distancing and sanitization. And in this week, we are now sharing with you the work we have been doing in the sectors of the economy, and more at a community level. What is the picture? Law enforcement agencies in Gauteng are working day and night in an integrated fashion, conducting operations under Operation Okai Mulao. They deal with crime as they've always done, and they report the numbers every week. But they also have an added responsibility to ensure that the regulations passed by the National Command Council are adhered to. I want to take this opportunity once more to thank our law enforcement officers for the hard work they are doing. They themselves are also coming face to face with COVID-19. We know that some of them, as law enforcement officers, have been positive, and these numbers get announced by the Minister of Police. So what is the significant picture in Gauteng is that where we are now, 21st of May, the level of compliance and public awareness is much higher than where we were at the start of the lockdown. And this we can say without fear of contradiction. The level of awareness and the level of compliance is higher. And we say it's higher particularly in the public transport system. Our Provincial Department of Transport, working with municipalities, have been doing tremendously good work. At the taxi rank, in a community, taxi rank, in the economic areas of economic activity, there's been lots of work to ensure that the taxi ranks are disinfected, but also to enforce compliance with the mask and compliance with the 70% load. So the level of compliance is higher. It doesn't mean that everybody complies. And that's why we have to do the spot checks. Even in the economy, the level of compliance in the shopping malls is increasing every week. When we do the spot checks, the MECs are going to malls, shopping malls. The reason we focus on the transport nodes is because they are areas of high risk for the transmission of COVID-19. The retail centers, the retail shops are also areas of high risk in terms of cluster outbreaks. So we have been focusing on that, and the level of compliance is improving significantly. Some malls are doing tremendously good work, and the shops in those malls. But there are malls where we know there's no compliance. And we are targeting those, we are going for them. MEC Mazbuko always gets sent to the most difficult of those to go and ensure that there is compliance. Also public open spaces, there's higher level of compliance. But we note, and this is a matter of great concern to us, there are still areas in some of our townships, people just go up and down as if COVID-19 doesn't exist without even wearing masks. There are still areas where people crowd together, others even play sport in those areas on the football grounds. We have been identifying those areas. So this is basically about behavior change. We think with the business sector, I'm going to conclude by talking about the meeting we had with business online yesterday. We think with the business sector, we will get everything right and every sector to comply. Or if a business doesn't comply, we will simply shut that business down. We can't put the life of workers at risk. With the business sector, we are moving steadily to ensure 100% compliance. With public transport, we are also working very well with the taxi industry to ensure compliance. And the taxi industry has really been great. Often people complain about the taxi industry being an area of lawlessness. I think COVID-19 has really shown the best in the industry because the industry leaders have really been very helpful in ensuring that by and large there is compliance with the measures put in place to minimize the spread and contain the spread of COVID-19. The critical issue in our communities, and this is where our key concern is shifting now, is that the police cannot force people to wear masks. The police cannot be, it's not the job of the police to help change behavior. And I want to say to the people of our province, every one of us is responsible for helping to improve compliance with measures that will ensure that we don't only just flatten the curve, but we minimize the level of infection in our communities, because we know most of these communities are high risk and vulnerable areas. We want to call on communities to really work with us street by street to ensure that there's compliance. And for this reason, we are escalating community mobilization. MEC Masuku is going to talk about what we are going to be doing, learning from what we have done in the past 2 months, but what we are going to be doing to improve the level of awareness and the level of compliance. So the key focus is going to be on communities. So as we ensure sectors of the economy comply, we're focusing on the communities and especially the hotspots, and that's what MEC Masuku is going to be talking about. So just talking about compliance and awareness, we have identified, I've said to you, we have identified sectors of the economy elsewhere in the country and learning also elsewhere in the world, which are high risk. We have already spoken about the retail sector, and that's why we are taking no chances. There can be no shopping mall or shopping center in Gauteng that operates without enforcing these measures. Every time citizens draw it to our attention, there is a shop there where they are not enforcing social distancing, where there's no sanitization, where they are allowing people to come into the shop without masks. Every time this is brought to our attention, we get to that area. But we are also monitoring what's happening with the manufacturing sector and mining sectors. Mining has large volumes of employees. We're seeing it elsewhere, that in Limpopo, for example, that mining can be a source of cluster outbreaks. So our team, having worked with the retail sector, our team is now going to be focusing on the manufacturing and mining sectors, and all the sectors where you have large volumes of workers. And that's the work we are going to be doing. We are going to be hitting these areas, unannounced inspections, but also just proactively working with business leaders to make sure that they come to party. Part of what we have been doing is to do this intensive engagements just on level 4. For example, yesterday we went to Roslyn. There we are checking those businesses that are operating at the moment under level 4. How much are they complying? Even before we think of level 3, are they complying with the health and safety protocols? Are the workers in those businesses happy? And when we go to those businesses, we also interact with the workers to get a sense from them directly. The people whose lives are put at risk are the workers. And we want to say that we will not advocate for the opening of the economy at the expense of the workers. We will not want to advocate the opening of the economy without ensuring that there's compliance. In Gauteng Province, when these measures once they are approved at a national level, once they are approved and they are announced, we focus on ensuring that all the sectors of the economy are operating in compliance with those measures. So we have first been focusing on level 4, but at the same time we are working with employers to prepare for level 3. And we basically want to make sure that workplaces have risk assessment plans that must include, but not limited to, the provision of screening and testing facilities. So we want employers, especially where you have larger number of workers in those places, we want, when the workers arrive at the workplace every day, they should be screened. And we are working with these employers. Some employers are big enough, they would be able on their own to put in place testing facilities, working in conjunction with the health officials. We were at Roslyn yesterday, and we were quite happy with what Nissan and BMW are doing there. They are not only doing screening, BMW is also doing testing. They have their own doctors who are doing testing. They do screening every morning. These are some of the things. We want this to be part of the new normal, as part of managing the pandemic. So when we say the economy, so the president last week announced that the country is preparing for level 3. So for us, when we say we are ready for level 3, is when we have ensured that each of the sectors have first complied with level 4, but they are also having in place these measures that will really help ensure that there's return to work in a safe way. So the World Health Organization has got these protocols that help guide countries in implementing. Part of what we want employers to do is to disinfect workplaces on a day-to-day basis. And we've already said we also want them to screen and put in place testing capacity. And in areas where the employer are smaller employers, they don't have that capacity, we will work with them to ensure that we have this screening and testing facilities. And we will ensure there's an alignment of workplaces, high-density workplaces in Gauteng, where there are larger numbers of workers. We will also ensure that our district health services in those areas are able to service, so that if there's a case picked up, a positive case of a worker picked up that day, that there must be prompt response from the authorities and the employer in ensuring that appropriate action is taken. If the worker is isolated, and some of the employers were sharing with us yesterday some of the measures they have in place, including transport measures, to ensure that the worker who has tested positive gets home safely. It is the responsibility of government, once we have that worker, to know this worker will not be able to self-isolate. We must put them in the quarantining facilities. And I just want to share with the people of our province today that yesterday we had very fruitful engagements with more than 160 CEOs of companies located in Gauteng province. We did this online. So it was a very fruitful online engagement. We looked at two issues. Firstly, we were assessing with them if those that are working at the moment under level 4, those sectors and businesses that are working, we were assessing how much they have put in place health and safety measures to protect their employees and ensure that their workplaces don't become the source of cluster outbreaks. We assessed that with them, but we also assessed with them the readiness for level 3. So we are very happy that business leaders expressed their support for the measures that have been introduced by our national government since the lockdown, and including the lockdown itself. Business leaders in this province we spoke with yesterday, the CEOs said they understand that and they support that, and they have seen that the lockdown has really, really helped, and they can even see in the province that the work that we have been doing so far has been able to contain the spread and flatten the curve. And I think the important thing is, how do we learn from this and move forward? And one of the things around which we agree with business in this province is that we must always have a balance, strike a balance between the public health imperative and the economic imperative, and not think that we must just open the economy anyhow and endanger the lives of millions of workers who work in this economy. We have more than 2 million workers who work in the Gauteng economy. We can't want to endanger their lives by just opening the economy anyhow. So we are agreeing with the public health measures, but we also agree that we can't be in the lockout forever because it will be very costly. It is already costly, and we went into the lockout fully understanding that we've got to go that route. So as we were having these discussions with business, we're also saying, how do we make sure that Gauteng is ready for level 3 when the decisions are made by the NCC about level 3, which parts of the country will be at level 3. And indeed, the general sense amongst us is that our province, given the work we have done, and this work we still have to do in this week and next week, we will be able to ensure that the whole of Gauteng is ready for level 3. And I think we said so together collectively, saying it's not about choosing the economy over life. We must do this when we are sure that we are able to contain the spread of COVID-19. So obviously one of the important things for you to know is that we are worried that Ekurhuleni has become, just as a district has become at the level of a district, is now our hotspot. You remember Johannesburg may have more numbers, but Johannesburg has stabilized, it has got more recoveries. But Ekurhuleni, in terms of new infections that we are tracking over a period of a week, Ekurhuleni is becoming a big concern for us as the province. So we are directing a lot of efforts towards this metro. But we also agree in our discussion with business that Gauteng is a highly integrated space. The special economy of Gauteng, the special reality of Gauteng is that we are a highly integrated, essentially, we are a single economy. So the metros are interdependent. People work in one metro and they live in another. Businesses operate, they may be producing something in one metro, but their head office is in another, and their value chains are linked with another business, or the supply chain is linked with another business in another district or in a metro. So we are a highly integrated space economy. And therefore, when we move from one level to the other, and this is something businesses were able to sketch for us, how in manufacturing they may have an operation in one metro and another operation which complements their final value chain in another metro. We're agreeing with them, and this is something I've been articulating for years, that the Gauteng, what we call the city region, is precisely that. We are a city region with a single integrated economy. Yes, we have municipal boundaries. Yes, we have separate demarcations. But from an economic point of view, those demarcations don't make any sense. We have a single economy concentrated in a small geographic space. So when we move from one level to the other, we must always take into account that we are dealing with this space. So if one region is open and another is closed, you may as well just shut down the whole economy. It would not make sense. There will be lots of blockages. There will be lots of logistical and operational blockages. And it is for that reason that we always want to pay attention. A region or a metro or a district that becomes a hotspot, we direct all our efforts there to make sure we can contain the spread. And that's what we are doing now. We are directing our efforts to contain the spread in Ekurhuleni, which is now our red district at the moment in terms of color coding. It is the red district, which means with a lot of new infections are coming out of there. MEC Masuku will explain immediately after I conclude now how this strategy of looking at a district or a metro that has got higher new infections is linked to our hotspots in communities, community hotspots, especially township level hotspots interventions. And at this point, I would like to call MEC Masuku to come and present the Gauteng hotspot strategy, which is linked to what I just presented. So how do we move to the next level? How do we make sure we move the whole province to the next level together?
Thank you, Premier, and good afternoon, ladies and gentlemen, and members of the media. I'm going to touch on the issues raised by the Premier, which relates to our approach to hotspots and also to areas with low infection rates, which is in our province. It's Sidibeng and West Rand. This is a strategy that has been evolving over a period of time since our first case that we had on the 7th of March. And we are also saying that it has not really reached perfection, but we are continuously making sure that we perfect it and make sure that it evolves and it remains dynamic and it is agile. So some of the things that we have actually noted is that our health establishment have actually experienced a lot of stoppages in relation to infections of healthcare workers, including patients. So one of the things that we have done now succinctly, that we have developed and put it into action, is to develop a response that all our districts will have to follow, which will make sure that we have a standard way of responding on when an institution or a facility has got an infected individual in that instance. And as we know that these are teams that we are going to be calling response teams, are actually also linked to the teams that are dealing with the shortage of PPE on live time, and they're able to respond at any given time. So this response team will always be available to provide support to the management of the facility and also to the COVID steering committee which exists in the facility. That the steering committee is actually constituted by the labor unions, particularly those which are recognized at the facility, and they are the ones that oversee all the issues relating to occupational and health and safety areas and measures that are put into place. So the response team, as established, will actually make sure that it supports the management, it supports the steering committee to ensure that we are able to resume the services of the facility at a stipulated time after decontamination. At least this should happen within a rapid time, and at this time we are talking about an hour after the case has been actually reported. The team also will be able to activate tracing, contact tracing of the individuals that have been exposed to the infected healthcare worker. And this also, when we say tracing team, it also includes activating the laboratory services. This is one area that we have actually able to improve, because the turnaround time of the results actually rely on the laboratory services, and we have been able to enlist a private laboratory service companies that help us to make sure that the response time is quite quick, and we're able to get the results as quickly as possible. And the decontamination company will also be able to respond in areas where that requires decontamination, and that actually should follow. This is actually aimed to make sure that we limit the number of, or to reduce the number of time that the health facility will be actually interrupted in terms of its actually services. Part of the establishment is also to identify contact with the positive healthcare worker, also be able to immediately arrange counseling, debriefing of the affected healthcare worker, including the colleagues, and also do a lot of testing of the contacts, particularly the primary contacts which are at the workplace, and the secondary contacts which are usually the people that are at home. We also, the part of the plan or the part of the duties and the obligations of this response team is to make sure that we arrange when the healthcare worker or those who are contacts can't actually quarantine or self-isolate, and we actually have to arrange that. So this is also just to make sure that our response time is quite quick and is quite time effective, and is able to reduce and limit the interruption of our actually services. The second part of my presentation is to deal with what we are calling the ward-based COVID response plan, which deals with the hotspots. Because the hotspots, as the Premier has indicated, these are areas that have got high number of individuals who are infected and high number of individuals who are contacts. And now, because we require more of the community involvement, we require more of the society to be the one that enforces the regulations, particularly at ward-based level. We are working with the Department of COGTA, Cooperative Governance and Traditional Affairs, to make sure that these teams are actually improved and they are put into place, and they are also multidisciplinary and multi-actually sectoral. These teams will also include civil society. It will include FBOs, faith-based organizations. It will include NGOs. It will also be linked to EMS base. It will also involve our community health care workers and EPWP people that we have employed who will be working throughout, and also our public health experts in our clinics. And it also will involve GPs and family physicians around the area. So these are teams that are going to have the data, that will be able to know that where the individuals are, and also help us to mobilize society to be able to enforce, the regulations. And also part of the intervention will include issues of social security, in terms of food security and others, and also address other public health issues which we are all concerned about, and also improve education about COVID, also look at people who have to be compliant with HIV and TB treatment, and also look at other chronic conditions. So this is a multi-sectoral, multi-faceted, integrated way on how we're going to be dealing with hotspots, not only dealing with COVID, but also focusing on other aspects, including your TB and HIV. And this is a committee that we're hoping that going forward will form the basis and the nucleus on how the national health insurance will be implemented going forward, because prevention, we know, is better than cure, and prevention is a better strategy and which is cost effective. And in this regard, as we have said before, that we are going to use the COVID response, our COVID response, as a good opportunity for us to put into place sustainable interventions that will make sure that our healthcare system remains dynamic and it's able to respond to many aspects. I think, Premier, those will be the issues that I would want to address, and then the others will address them as we deal with actual questions. As I hand over to the MEC of Education, which we are working with in terms of preparing for the reopening of schools in Gauteng. Thank you.
Thank you so much, Honorable Premier, fellow MECs, and members of the media. We want to take you through on the reopening of schools, our readiness as a province of Gauteng, the things that we've put in place, as well as the processes that are still outstanding that will work together with our partners to ensure that we do everything. Just to ensure that we have everything in place, we just want to give you a context that grade 12s and grade 7s in our province are 3,000 in total. This is the number of both grade 12s and grade 7s. But we've got a total population of 2.8 million learners that are utilizing almost 2,400 schools. That's the number of schools that we have. But for the preparations of the reopening of schools, we are now working around learners that are in grade 12 and grade 7. We are working together to ensure that even learners that are in ELSEN schools, that is learners with special needs, they are also taken care of and they are supported together with our general assistants, that is our general staff members. We want to put in context so that people can understand that the decision to open schools or close schools lies with the President of the country. And the President of the country delegated that authority to the minister. And the minister, in executing this mandate, convened a meeting of all MECs. And in that meeting, each and every province was requested to make a presentation. We made our presentation, which is a presentation that we want to share with you, to outline where we are as a province and our readiness. In formulating that presentations, we had various consultations with various institutions. I want to take you through that consultation. Firstly, we started with our Provincial Command Center led by our Premier, that is all the MECs, and we presented our readiness. On the basis of that, we went to consult with all teacher unions in our province, both labor unions and teacher unions. And immediately after that, we went to consult with the SGBs. And after the SGBs, we went to consult with the Provincial Portfolio Committee that incorporates all other political parties. And subsequent to that, we met with the MEC for Health together with the HOD so that we are guided by their health guidelines that they've established. And immediately we are going to meet with learner formation. So we're meeting with learner formation so that learners, we don't assume that they are ready. We can meet with them and deal with these things. After this, it's our view that we need then, before the schools reopen on the 1st of June, with the relevant observation of the regulations, we want to have an open day in our schools so that parents can come and check our readiness. With the necessary observation, they can come and check indeed we are ready before they can allow their children to come to school. We are also making the input that we are giving it to you now. We are going to release it for public comments as well, because we don't want to claim that we are the only one that have an ideas. We also want members of society to give input to the document that we are sharing with you so that you can understand where we are. Let's start with the cleaning of our schools. What we have done, we've categorized each and every school. For a school to get ahead, it's not a school readiness, it's a classroom readiness. So we are starting first with the classroom. Is the classroom ready? And the classroom to be ready, it means that it needs to have the necessary PPEs, there must be relevant social distancing, every learner must know where they sit, and there must be a lesson before you enter into the classroom to observe the wearing of masks and also ensure that you've got your package. The learner package includes a face cloth, masks, a soap, as well as a bag where they would have to throw in things that they are no longer utilizing. So the cleaning of schools in our province will be as follows. All the SGBs will receive allocation from head office, which means each and every school will have an allocation of more than 15,000 rand each. That will allow each and every school to start the cleaning. We've given schools 8 days to do deep cleaning. They will appoint their local contractors or local people or add to the number of staff members that they have that are doing their normal cleaning. And only then they submit a letter to the district to say the district must come and observe whether the school is ready and has been cleaned. And thereafter we'll then work with the Department of Health, which will then give us a certificate of occupation to say this school is clean, learners can come, learners are ready. We also have schools that we know there's that dysfunctional SGBs and that the school are going through difficulties as well. There are 577 schools that we've identified that have got challenges. Those 577 schools, we received a donation, and I want to emphasize this way. We received a donation from a company called Bidvest that will donate their services as part of their social responsibility program. And they will go to previously disadvantaged schools and do deep cleaning. They've started yesterday and they'll continue to do so until our schools are ready. What we'll do now, each and every district office will be our command center. Each and every district will then monitor the readiness of every school and provide the relevant report to us that deals with the readiness of each and every school. For now, the first people to come back will be principals. They'll be followed by SMTs. Immediately after that, they'll be followed by teachers. And immediately after that, learners will come to join us on the 1st of June. But our approach in Gauteng is as follows. The PPEs must arrive first, and then the principal will then arrive to receive, and the principal will wait for SMT PPEs. When the SMT's PPEs arrive, the principal will then ask the SMTs to come back to school. When the PPEs for learners come, then that's when we'll call learners, or the PPEs for teachers come, then we'll call for learners. So it's PPEs first, and then resumption of responsibility. So where there are no PPEs, we are not going to risk educators or teachers to come, or learners to come to our school. The overriding ethos that we are following in Gauteng is safety first. That everything that we do, there must be safety. And on that basis, 1,752 schools have been given the necessary capacity to say that they can start cleaning. And 577 schools, as I've already indicated, will be working together with Bidvest to ensure that those schools are clean. In cleaning the schools, we are also taking into consideration the schools that we have vandalized. In Gauteng, we have 331 schools that have been vandalized. Of those 331, 7 of them have their admin block banned purely because we had people that were attacking our admin blocks. We can assure parents of those 7 schools that they've already procured the mobile classrooms, and schools will work from that area. But for now, because we are only welcoming grade 12s and grade 7 only, we believe that the environment will be enough for everyone. It's only when we are bringing other grades that we'll need to start to making improvement. Of the 313 schools, we have already started the procurement processes, and we really believe that by the time the schools reopen, the minor repairs will be completed as well, especially for those grades that are coming back. That's grade 7 and grade 12. For purpose of control in our schools, we are putting it quite clear. No visitors will be allowed in our schools. Any person that will be a visitor in our school need to get permission first from the district, and district will seek permission from head office. We don't want people that have not been screened to enter our school premises. You will see that even in our plans, all schools that don't have fences, we're going to fence them immediately so that we don't allow strangers to interact with our children or allow strangers to infect our children or our staff members. So all schools must ensure that there is one exit gate and one entrance gate. So all the gates that were used before will now be locked, and all the schools, especially outside, there will be social distancing marking outside each and every school so that learners don't rush to get inside the school premises, but they must form a queue, and when they're in that queue, they'll be sanitized. Only those with masks will be allowed, and those that don't have a mask will hand over a mask to them, and their temperature will be taken together with the temperature of teachers. Areas that are out of bound, that is playing fields, soccer fields, they will be cordoned off immediately with a red tape to indicate that no one can go there. And the security will only allow those people that are wearing masks. We want to emphasize that point, and I'll touch that point at the end to say our preparedness in Gauteng is not only for those that want to come to our classroom. We'll outline the entire plan at the end, that it also involves those that are doing homeschooling, and those that are feeling that their children must not come to school. We'll put other system for them as well. So we'll share that information with you as we as we proceed with this presentation. I've already indicated that our staff members will provide them with the relevant PPEs, and every person who enters our school premises, that is our staff members and our learners, will be requested to fill a form that will take their temperature, their name, surname, the grade that are in, physical address, the parent's cellular phone and learner's next of kin, contact number, so that if something happens, we can immediately report that to their next of kin. And we are putting also what we call isolation point, where we are isolating those people that we believe their temperatures need to be checked. We've entered into an agreement with the Department of Health, and thank you so much, the Department of Health. Each and every school will be linked to a clinic, so that if the school does not understand the situation, they can be in a position to make contact with that clinic. Secondly, we are procuring the services of general practitioners, what we call GPs, that is township doctors. This procurement of these doctors will allow them to start at our schools first before they go to their surgeries in the township. This is where they will attend to those people that are at isolation points, but they will also monitor our teachers to check everything is fine, and learners as well, so that if they pick up something that needs immediate attention, they'll be in a position to assist us. We are also having the Department of Health seconding young people to our schools to do all the relevant screening and also to check social distancing, as well as the distribution and the teaching or training on the wearing of masks and the need for learners to ensure that at all times they are wearing their mask. This training will also involve the classroom, which simply means that each and every teacher, even if they are teaching accounting, before they start teaching accounting, we'll give them a script to explain to learners what is COVID, the dangers of COVID, why we are in this situation, and the importance of social distancing, the importance of not touching each other or sharing ballpoints or sharing a ruler or other thing, and the importance of them wearing the mask appropriately. So every day there will be a script that the teacher will be provided so that our children can understand the new order that we find ourselves in, and our district officials will be providing that kind of support immediately. We are also aware that majority of our educators are above the age of 60. So what we are doing now, we are creating a pool of new teachers. For now, we are starting with 50, but we know that we might need almost 300. So we are in the recruitment drive. Those teachers that are above 60, that they believe they've got comorbidities and they cannot come to work, they can work from home, we will provide them with that support, but we'll put substitute teachers that will provide that kind of assistance that is needed. This is very important to us because we don't want educators that might have sicknesses that may infect our learners to be within our school premises. So as of now, all these teachers that are above the age of 55, we've already written to them to identify their sicknesses in a secretive, respectful manner so that we can determine whether they should come back or not come back. And if they're not coming back, we're going to have substitute teachers. The reason that we need lots and lots of substitute teachers as well is that because of social distancing, each and every classroom, instead of having 40 learners, is going to have 20 learners, which simply means if it was grade 12A, it's going to be grade 12A1, grade 12A2. So grade 12A1 must have its sets of teachers, and grade 12A2 must also have its own new sets of teachers. And you will see that the teachers that must come back to teaching is all teachers, so that even if we are starting with grade 12 and grade 7, all teachers must come so that they can assist in teaching other grades that we've identified. We've also went for a recruitment of what we call covert youth brigades. These are young people that will ensure that in the school there's social distancing, learners are not touching each other, they will assist us with screening, and also they will assist us in providing the overall support. We are looking for 7,000 young people who have received 120,000 applications. We are quite excited with this because we'll use these young people also on other things. So we'll deploy 4 youth brigades in each and every school across the province. These are our monitors. And you will see as well when you speak about scholar transport, each and every bus of scholar transport will also have these young people inside the bus so that they check learners that are coming in, they are screening them, they are also ensuring that they sit properly with social distancing, and that in that process as well, they will read a script to explain why the bus is no longer full. There are only 70% of them, so that they understand the new order that we find ourselves in. We are also providing water to all our schools. There are 67 schools in our province that have challenges of water. Out of 2,800, all of them will receive water tanks. Actually, we have already started delivering these water tanks. And these schools will get the water tank changed daily so that learners can use those water tanks. As I said, we've got 67 schools in our province that have challenges of water. We're working together with the Department of Water Affairs in this regard. So we're quite convinced that come the 1st of June, the water tanks will be available and there will be a supplement, there will be a necessary supplement to all those lands. These schools have water. The only problem that they've got challenges of water pressure. So to supplement that, we are providing the relevant water tanks. We've emphasized the issue of classroom cleanliness and classroom hygiene. So there will be guideline documents that must check daily before the school starts and when the school closes on hygiene matters. What will happen that learners will be screened 3 times and teachers will be screened also 3 times daily. When they arrive, during lunch break, when they go home. Because when they arrive, they're coming from their different families. We have to ensure that they don't infect others. We must check. When they go for a break, before they go for a break, we have to check them. When they go home, before they go home, we have to check them so that they must not go home and infect their families. And these are the things that we're going to do. And the desks and the classroom will also have 2-hourly intervals to check that everything is still in order. And once a month, we'll do fogging of all our schools so that we don't have any problem. I've already spoken about the PPEs. Every learner will get 3 face cloths every week. And we are pleading with parents. The first one will be surgical mask. The second one will be cloth mask. there will be 2. We are pleading with parents, please wash them and ensure that learners protect them, because we might not have the budget to replace those face masks daily. That is why we're giving them weekly for now, and then we'll give permanently 2 of them. The only challenge is first day. We're urging parents, we have the PPEs at our schools, but first day, because learners are coming from families, we're urging families to give their children something to wear as a temporary measure, and they will get the permanent measure at our schools so that all our learners are safe. In terms of school nutrition, currently, as I'm speaking to you now, all our food handlers, the voluntary food handlers, people that are cooking our food, all of them are attending a compulsory training to prepare for the first. We are training them on how to handle food, how to dispose food, how to wash the utensils with the relevant tools that have been given to us, and also how to observe social distancing. But we really believe these are the people that will be in touch with our children. So they have to go for screening, and they have to be screened before they serve food, even after they've served food, so that we are all. We will provide school nutrition to our schools. We are pleading with parents for children that don't utilize our school nutrition. Please prepare the kaftini zabona. Parents must prepare those ones, and they must prepare them in a manner that is safe. But those that are part of our school nutrition program will provide the support that we have just outlined. So there is a complete regime and protocol on school nutrition, and why food handlers and learners will have. So learners will not eat for the first time, which is something that I know our children will question us why. For the first time, there will be no break that me and you are accustomed to, where the schools open the classroom, everyone go and play and other thing. The first group will go for break, say at 10 o'clock. Another group will go at 10:30. Another one will go at 11. And the last group will go at 11:30. Our school nutrition is also meant for learners that are in other grades that we have not opened. If they stay in the community and they need school nutrition because they rely on school nutrition to get food, they will be allowed to come in, but also they will practice social distancing. So grade 11s and grade 10s from that are using school nutrition will be allowed to come to our schools after we've fed those that are in grade 10 and grade 7. And also they will have to observe social distancing. We're working together with the Department of Social Development on this aspect. On scholar transport, it's very simple, observing the 70% rule. Scholar transport, the bus will be sanitized, cleaned, because we don't know who was using the bus first. So the bus, before it takes our children, it will go through a regime of cleaning. We are working with the Department of Transport here on this one. And there are 212 service providers in this category that are servicing our children. We've also added 1 new buses so that we can observe social distancing. But parents that are using private transport to ferry their children to school, you have to observe the regulations as announced by the Minister of Transport. We are meeting with these private transport people that gone are the days of overloading our children. We have to observe social distancing. You also have to ensure that no learner enters your transport without a mask. And you have to ensure that you have a sanitizer as well. If you don't have those things, you are not going, your child, that transport is not going to be allowed to get into our premises to offload children. So it's not only our scholar transport, but it's also transport that is taking children privately, that is arranged by parents. For now, we don't think it will be a problem because we are only taking grade 12s and grade 7s, but we are requesting parents to monitor this aspect on our behalf so that children are not overloaded and we observe social distancing. We want to move quickly as well in terms of psychosocial services. As we have said, that each and every school will be linked to a clinic and will have a general practitioner that we are currently in the process of procuring with the Department of Health that will come and monitor our schools. We are also providing psychosocial support to all learners and to all teachers. This is very important so that teachers can open up if they are picking up symptoms of sickness. at an early stage. And then we can then make replacement and provide all the relevant support that is needed and everything that they feel that they need, especially testing. We've indicated that with social distancing, the classroom is going to be marked. Gone are the days of 2 learners sharing a desk. It's 1 learner, 1 desk. And having 1 learner, 1 desk, it's no touch, no ruler exchange, no ball pen exchange. This will be difficult, but we are going to ensure that learners get used to this thing. Because if we can't provide that kind of social distancing, it will be very, very difficult for our learners to understand why. That is why every class will start with this kind of a lesson. We have gone to each and every school, so we have identified the classroom in terms of social distancing, and we have all this information now. But some schools have different sizes of classrooms, and we are assisting those schools so that we have. So, for an example, a classroom that has 40 learners, we are reducing it to 20. But there are some schools that you might find that the classroom was putting up, say, 70 learners. We are reducing that as well to 20. So there must be no classroom with more than 20 if the space does not allow. And we'll be in a position to monitor that and ensure that we get reports. So each and every school will have a daily report about the quality of the PPEs, because we don't want to give them PPEs that don't have quality. They will give us daily reports about social distancing. They will give us a daily report about the screening regime. They will give us daily report about what happened in a school, so that we can consolidate and take that report to our provincial command center, so that our provincial command center can get reports and guidance. So there's a strict regime in monitoring so that we can ensure that our children are safe and everything we do. In the long run, not now, in the long run, we have to make a decision as a province, because with social distancing, there's no way that will bring all the grades. If you are bringing grade 10s, you are bringing grade 11s, grade 6 and others, and have the same class size. So we'll either have shifts or what is called platooning. There will be learners that will come in the morning and they knock off at 12, and others will start at 1, knock off at 4. It's one proposal that is on the table. There are other learners, either they can come on a notional time. That is, they come on a Tuesday, others come on a Thursday, others come on a Friday. So there are various processes that we are currently discussing. But now there's no need, because we're only taking grade 12 and grade 7. It's just that the team wanted to ensure that the planning goes very well. We've revised our curriculum so that it can meet maybe before we can start with the curriculum part of it. I want to assure parents, as Gauteng, our approach is on 4 interlinked or integrated classes. When we are opening on the 1st of June, we are not opening for those that want class contact. So we'll have class contact, those people that want teachers to teach them. But those that are saying, hey, I'm fearing for my child, I want to continue with e-learning or online learning, we'll provide support for that. Those children that are children with special needs, children that are sick, we are going to provide support for that. Those that wants to apply for what we call homeschooling, that you are moving your child from going to school, you are going to be the teacher of your child as a parent. The homeschooling one, the deadline, we're extending it to the end of September. On our website, we'll put details to do that. So we're opening schools for everyone. We're not opening schools for a certain sector of class or people. So those that believe that the learner will be better off in terms of class contact, this is what we've just shared with you, our readiness to do that. Those that feel that I want my child to be on homeschooling, we are giving you the support for homeschooling, and we'll give you the guidelines of homeschooling. Those that said, I've got children with special needs because they are sick or they cannot cope in this, will provide support for that aspect, and so forth and so forth. But there are other schools that are special schools. For example, the school for the deaf. You can't say, because the school for the deaf, you are waiting for grade 7 and grade 12, because in the entire school, there are just 35. So all of them must come back. on June the 1st, because they don't have problem of social distancing and matters that are related to that. So we've got a revised curriculum that we are going to make available to all parents and all learners. So even if you are taking grade 12s and grade 7, the parents of all other grades, we will call you to come and collect material for all other. It's not a holiday for those that are at home. So they will be given days to come and collect material for those children, because our schools are now open. But obviously, observing the relevant regulations as we have put. So we are putting up a lesson plan on TV platforms, on radios as well. We'll continue that aspect. We're giving exemplar assessment tasks, including previous question papers, and also each and every parent will have the curriculum so that they can understand how they provide their support and all those things. We want to leave it here, Premier, but we want to assure parents that we are preparing for the examinations as well from now on, because they must arrive first. Even when they're going to write examination at the end of the year, there is an examination regime that we've already outlined. So we want to assure parents, I'm a parent as well, Premier. My child is going back as well, is in matric, so she's going back to school as well. We want to assure parents that we are careful about this matter. We have taken all the necessary care, and we have ensured that our schools are safe and that will provide the relevant teaching that will assist our children at all fronts. We also want public opinions on this thing. We don't say, as Gauteng government, we know all. We are going to make this document available for public comments starting from Monday until next week, Friday. Every parent that feels they can enhance this document, our readiness, we are willing to take that. We'll incorporate their views so that by the 1st of June, when we opened our schools, every parent and every person have contributed to this document and can be a document that all of us are proud of. Thank you so much, Premier. Truly appreciate it. Okay, let's deal with the independent schools as well. There are schools that are not subsidized by government. We are working with them. They are going to have their own regime of opening. But all our independent schools that are subsidized by government, we are releasing their funds for them to go and procure PPEs. And we are requesting them to follow the same regime. The regime that we have outlined here, we want them to follow the same regime. There are schools that are not registered and are independent. Our team is going to hunt those schools so that we can also assist those schools, because those children remain our children. We don't want them to be at risk as well. So we'll provide all the relevant support that is needed. I'm missing our private schools as well are working with us, Premier, I must be honest. All our private schools are working with us, so we are in the same regime. But because they've got different class sizes, they might have different grades coming back, but we are working together to monitor the situation. Premier, I can't wait to see my children on the 1st of June. Thank you so much.
Thank you very much, Premier and MECs. We will now take questions. Do I see any hands? Okay, can we move the mic over there to Ndaezo?
MEC Lisufits Ndaezo from Power FM. MEC, I just need to get clarity. So you say safety first, right? And when I look at the days that have been allocated in order for schools to have the PPEs, we've got about, what, 4 or 5 days? Are you confident that schools, all the schools that are in the province, would have all the PPEs and would be ready to resume learning on the stipulated date for both grade 7s and grade 12s? And if some schools don't have and learning doesn't start on that specific day, is there a plan, maybe a catch-up program for those learners that would not have started school due to safety concerns? Thank you.
Okay. Do we have more? Okay, I don't see any more hands. But there's a few that we received on WhatsApp. There's one from Arisa van Rensbeck, from Network 24. It says more than 40,000 deaths are expected countrywide. At this stage, we have seen high numbers from across the world. Many states and countries have started with mass graves. Is the Gauteng government preparing for mass graves as well? I think we've had this question before, but yeah, the Premier and the MECs will decide. We have dealt with it before, yeah, sure. Another question, I don't see the name here. Oh, okay. Thando Kubeka from Eyewitness News. We understand that Gauteng wants to test 3,000 people a day, but it is only getting about 2,000 tests done. What is the province doing to address this? Second question, what is the province doing to address the delay in people getting results, test results? He says currently there's a waiting period of about 2 to 3 weeks. What is being done to speed up the process? Then there's another question from News 24 for the MEC for Social Development schools. It can't be MEC for Social Development, it's MEC for Education. Schools are set to reopen in June. What will happen to the homeless at schools or housed at schools? Well, I see, it is social development. How many schools are housing the homeless? Is there a designated place where they will be moved? As South Africa moves to level 3, what will be happening to the homeless people? And another question for the MEC for Education regarding the invite for unemployed graduates. I think this is with regard to the brigade. How will the process work after applications are received? What vetting process will be in place? For how long is the program expected to run? I'm sure the MEC will be able to answer. Okay, yeah, that's all.
All the testing issues will be MEC Masuku. The testing.
Okay, MEC Masuku will deal with all the issues about health. And the Premier will answer the question about the mass burials.
Thank you, Premier, for taking the most difficult question. But I would like to indicate that to Ms. van Rensbeck that indeed we are having a plan, but it's not about mass grave, it's just about our discussion with our funeral parlor owners and also with our local government municipalities in terms of the availability of space for graves. Because we also, like the Premier has indicated, that we don't want to be underprepared. We'll rather be overprepared, which it's something that we are actually doing going forward. So it's not about mass graves, but we are preparing for space in our graveyards with our municipalities and our funeral parlor owners in terms of checking for space of pens, as it's called, not actually beds in the mortuaries. I think the issue of tests, I think we do get over 5,000 tests a day. If you look at the numbers that we have actually provided today from NHLS, which when you look at them averagely we do over 5,000 tests per day. And we are working very hard. We have already enlisted a private owned laboratory company, which is helping us to improve the turnaround time of the testing. And I think the important aspect about the testing is just for us to be able to have limited and less disruption of actually services. And we are also working on with the private sector, like I've said before, that there will be available testing machines that have been given to us for us to be able to utilize actually moving forward. Our focus point, particularly for the turnaround time of the tests, it will be our healthcare workers particularly, and then when we deal with areas of hotspots and many outbreaks, it's when we're going to utilize our private labs and even our own machines of actually testing. And I think this is how we can be able to deal with it. And we also made a call with the private companies, with the private sector, to actually continue with their screening and testing programs, particularly in the areas that the Premier had actually spoken about, that we have identified as high risk, your mining sector, your factories, industry, construction, and also the retail sector. We are continuing with the screening and testing in those areas. So we are, in a sense, having said that we are improving on our testing, we have actually improved going forward. And I think part of our approach on our ward-based community social mobilization, which is multi-departmental and multi-sectoral, which is actually based on our ability to get our test quicker. And maybe next time when we do the brief, what we are going to provide you will be the number of tests that have been done and the number of results that we have received, so that we can also have a comparative narrative on that particular note. Thank you.
Thank you so much, Triple N from Power FM for the question. We are doing something that is called just on time, which simply means the PPEs must arrive first before the next thing can happen. So no PPEs, no opening of schools. So we don't want to risk, as we said, it's safety first. What will happen is that, like now, the SMTs, that is the senior management teams in our schools, they've been requested to come back. All of them have received the PPEs, so they can start to operate. We also have a regime to say which district will receive what when. And when you receive that, you open. So Monday is supposed to be all teachers coming back. And we are saying to all our schools, the principal must call the teachers when the PPEs have arrived. Yes, the official day for you to come back, it's Monday. But when the PPEs are not there, stay at home until your teacher tells you that, until your principal tells you that we have received the PPEs, come. And by that time, we'll have our youth brigade that will test everyone and ensure everything is fine and the teachers will get the PPE. So on the 1st of June, the day one itself, if you are teaching accounting, it's not going to be the way to teach accounting. On day one, we are taking children on covert protocols in our schools. So it does not mean when say they're coming on January 1st, it means then it's AEOU, MAWE, or any other thing. No. It's only about how the school will start to function so that learners can understand the new norm. And it's the distribution of things, because we have to distribute the PPEs to these learners as well. And we have to teach them how to wear a mask. Unlike me and you, we assume that we just wear. We have to teach them and tell them when to take it off. For example, when they're eating, they have to take it off, and when they put it back, and when they need assistance, who is the teacher that is assigned at the school to be the covert coordinator? If the mask is it's torn, you don't wear the mask, you bring it back. So there is a complete regime that we've put on the management of PPEs, both on the side of teachers but also on the side of our learners, so that we can observe that thing. So I can tell you, as I'm speaking to you now, we are starting to distribute the PPEs in our school. All our schools have received their first phase regime of PPEs. The first phase regime is your 25 liter of sanitizers, it's your mask, it's also the bar soaps and other things. So all our SMTs now have already received that. And each and every district has been allocated a date so that they know where we are. But it's indeed safety first. And when in doubt, consult the clinic that we have allocated to you. But also, as I said, we're in the process of procuring general practitioners that will also assist us to ensure that we don't have that thing. News 24, there were no schools that were used for homeless people in our province. There were no schools that were used for homeless people. So what we are doing now, we are working strongly. We are putting a submission to our Provincial Executive Committee on the management of homeless people post-COVID. We really believe it's a creative program that will assist the homeless people to get a second chance in life. As I'm speaking to you now, we are getting them documents with the Department of Home Affairs. Others have already got their IDs. For the first time, others have birth certificate. So there is a regime that we are following to assist them. Others are on soft skills on how to drive forklift, queue marshalling, plastering, and all other things. So the lives of our homeless will change, I can assure you. There are others that were giving them bursaries to study in universities when the academic year starts as well. So we've profiled all of them because they've been in our care for the last 6 weeks or so. We've profiled all of them. We know what are their demands. There are others that we've already reconnected with their families. That the family told the person to say, "Ungayi ebumnandini," and the learner or the person defied the parents why ebumnandini, and he suffered the consequences of ubumnandi. He said to the Department of Social Development, "Escort me back to the family so that I can apologize." And we apologize. We do counseling with our social workers. They are now reunited. So there are programs that we have. It will be a miscarriage of justice if we have to send them back to the street. With the work that we are doing, we really believe that there are going to be people that will respect the support that government has given them. The invite to the Youth Brigade, yes, we are looking for 7,000. They will start from the 1st of June. That is when the learners are coming back. The others will come on the basis of the teachers coming back so that they can assist us with the vetting. And the process for now is going to be for the next 3 months. If there is a need for us to extend it, we will be. But because we are going to have new visitors in our schools, all of them must go through vetting. And that's the requirement. No one will be deployed in our schools if you have not checked them, because we don't want problems that will come later. So it's now for the period of 3 months. We're paying them a stipend, and majority of them want to volunteer as well. They just want to volunteer. They don't even want to step the stipend because they really believe that they can assist their communities. There is one last aspect that I didn't present earlier on during the presentation, is that we are opening our online registration for grade 1 and grade 8. The online registration will go live on the 25th of June, and it will close midnight 25th of July. Normally we open for 3 months, but because of the situation that we find ourselves in, we are only opening it for a month. So I want to plead with parents, please be ready. If you want to register a child for grade 1 and grade 8, the online registration will go live on the 25th of June, and it will close on the 25th of July. Thank you so much, Premier. Truly appreciate it.
I just want to give concluding remarks. I want to assure parents as well that we will not be soft on ourselves, on our schools. As we said, that no business will be allowed to operate until or unless it meets these very stringent health and safety standards. there will be no school that will open unless this school also meets the stringent health and safety standards. It is, yes, about our children. It is also about the teachers and the workers in these schools. So when we say that we are working with business to make sure there is full compliance with all the health and safety protocols that will help us contain the spread of COVID-19, we mean it in every sense of the word, and we mean it in our schools. We know parents are anxious. We know it for a fact. Many parents are anxious. And we also know that parents are saying, but why should children be at school when a lot of parents will still be at home when the economy is not open? We are doing everything in our power to make sure that we move to the next level with the economy. Because with all the measures that are put in place, all the steps we have taken so far, the lockdown has given us space to prepare for the worst, to be ready for the worst. With all the measures we are putting in place to cope with the peak, we can't have the economy closed or operating at level 4 or forever. And I think the president made it clear when he addressed the nation last week that the risk-adjusted strategy of moving the economy to level 3 will apply. That's why we, as the economic hub of our country, are working so hard with every sector, with every business, and we want citizens and workers to alert us. If there's a business or there's a place that's not enforcing this, do what you do. I get lots of tweets, people who are alerting me, and I sent MEC Mazbuko there to go and attend to that. We will do the same. Even with our own establishment, government establishments, government offices, we will not be soft on ourselves. That is why when there is a clinic or a hospital where workers are saying, no, we are not safe, we don't have PPE, it's a matter of great concern to us. We don't want any part of this province to be the source of the next wave or waves of the outbreak. So yes, we are preparing for the worst, but at the same time, with all the evidence coming from everybody and the science as well as the economics, we can do our best as a province to prepare for the next level. To prepare for level 3, we can do our best to ensure that the economy is open but in a safe way. What's called a safe return to work. We will do the same. There must be a safe return to schools. That is why MEC Lesufi would like to do as we advise, that there must be an opportunity for inspections. This open day will help. Parents must satisfy themselves. My child goes to this school. I want to go to the school first and check if these things that government says will be in place are in place. Whether it's a private school or a public school, these measures apply equally. So parents, I am excited when parents are really, really taking responsibility and they're entering the debate and they are concerned about the safety of the children. I'm excited about that because we need more activist parents. We need our parents to be active in the education of their children, in their well-being, because these children come back home when they go to school and come back home. I also know that many parents are worried about if there's an outbreak and a child is infected at school, the child will bring the transmission home. That's the conversation that's necessary. Parents are having that. So we're not gambling with the lives of our children. So we want parents to work with us. Ensure that when this open day is announced, that you go there and check and say what was announced by the Gauteng Provincial Government, that the schools will be ready. The schools are indeed ready. We want workers to do the same. Those workers who will return to work, if the National Command Council says to our province, you are ready to level 3, which is what the reason we are working so hard is we want to convince the National Command Council that we are ready. And we do want to go to level 3. There should be no doubt about that. But it can't be a gamble. So if there's a factory and workers themselves need to say, I have gone to my workplace and I've checked that the workplace does not comply. My life is being endangered here. Workers must be able to take those issues and highlight them. We will descend on that workplace. If such a workplace doesn't comply, we will descend. This includes public service workers. It includes the workers employed by government. If there's a workplace that doesn't comply, a department or an office block or a complex where there's no compliance, let us know. We will not allow any workplace to operate as a source of outbreak or as an infection source, basically, where a lot of people are going to lose their lives because somebody is reckless. So we are not perfect. Government will never pretend that we are perfect. We learn as we go. We have never had to deal with a pandemic of this magnitude, not in the lifetime of our democracy. The last pandemic that was huge was in 1918, the Spanish flu, where 50 million people died and 500 million people were infected. The road ahead is still long. We don't know how many people will ultimately be infected in the world by the time we find a vaccine, because the only way really to overcome COVID-19 is when we have a vaccine. We don't know how long that will take. In the meantime, we are focusing on non-pharmaceutical interventions. So all this, that's what the researchers are calling non-pharmaceutical interventions, social distancing. All the measures for workplaces, for public spaces, for our schools, these are non-pharmaceutical interventions that to help improve hygiene, to help ensure that the public transport modes that people are using are not going to serve as a source of new transmissions. So as we as a country are indeed amongst those who want the cure. We want the vaccine. Our national minister always gives a report. We want the vaccine. In the meantime, there's no vaccine. So let's do everything to safeguard. And when the peak comes, because it is coming, we will be ready. We are doing everything to be ready, everything in that full sense of the word, to be ready for the peak. We work with scientists. Even in our province, we have a group of scientists we are working with that are sharing with us their own projections. Those group of scientists also are people, some of whom are social scientists who understand the nature of Gauteng very, very well. They understand the spatial design of this province. They understand the disease burden of this province. They understand many socio-dynamic elements of what makes Gauteng what it is. They are also advising us on how to deal with these issues in a comprehensive way. So yes, there's national modeling, but we also at a provincial level are receiving advice on how, including projections on what the impact of this will be. How many people we may lose in the battle against COVID. We are planning for the West. We are preparing for the West. But as we prepare for the West, we also want to introduce the new normal. We want our schools to work in a new way. We want our government workplaces to work in a new way. We want various private sector workplaces to also work in a new way. COVID is going to be with us for long. This new normal is something we want to do. So we can't just wait for the peak. We must prepare for a period much longer. So if we will still be in the COVID environment 2 years from now, we should also be ready in how we have adjusted. That is the reason we really want to mobilize people in the townships. We want to mobilize people in the townships, those who think that COVID is not for them. We want to mobilize them at street level. We want to involve the councillors. The councillors must not be involved in food distribution. The councillors must be involved in making sure that in the areas where they live, more people are aware. People are wearing their masks. And every institution, every establishment, from public establishments to private establishments, even a spaza shop complies. We want our councillors to help us get this message. If there's an area where there are 20 infections now, and this area people are just going up and down, and there's no real work of raising awareness in that area, we can end up with 2,000 infections in those areas. So we want to take this message and this work on COVID-19 to street level, to grassroots level. No mass meetings. I'm not talking about mass meetings, but I'm talking about getting religious leaders to have the information, getting community leaders to have the information in their area to know we have had so many infections in this area. Where are the people who have taken them out? Those that have recovered also it must be, where there's recoveries, people mustn't have a stigma. We must also do that. That is our step-up approach. So we are stepping up and we are focusing on where there is limited levels of compliance. And those are what the interventions on hotspots are. I got a question on Twitter about this issue of how many, when you say hotspots, how many numbers are you looking at? We use the word emerging hotspots. So we don't wait until there are too many people in an area. If there's a township where there was 0 case of COVID-19, and the following week we have 10, for us, we watch that place as an emerging hotspot. So, because we know the potential for infecting more people in high-density areas is huge. So if you don't act with the same speed, if you have one infection in a community or in an area where people live together in large numbers, if you have, like we did in Alexandra, we went to Stratla when there was one infection. We knew that if we don't intervene early there, if we didn't do what we did in Stratla, we could be talking something else now. So people who keep asking, but the cases are too few. Premier, you and the MEC for Health say that area is an emerging hotspot, but the numbers are too few. We're saying to you, please allow us to classify these places and intervene early to avoid more people being endangered. So we watch the numbers. They don't have to be 1,000 for us to say it's a hotspot. When we see, we never had a case here. Suddenly we have cases. Every day we are reporting cases in this area. We call that place an emerging hotspot. And that area requires as quick an intervention as the ones that may have been a hotspot for longer. So it's for the good cause. I want people to understand. It's not to cause panic. is for the good cause. So these areas that where we are picking up increase in cases, our people must conduct themselves in those areas with a great deal of respect. And let's not take coronavirus for granted. Thank you very much. We conclude today's briefing. Thank you so much for coming.